Members, deputations, we are about to start session 2 of the public hearing. Please take a seat. I will invite the deputations to come in.
專員，我哋第二節開始啊，專員。
Please, we're about to start the second session.
好啊，得我哋坐定先啦。好，歡迎大家。
Let me welcome everyone to the second session of the public hearing held by the Subcommittee on issues relating to the support for persons with disabilities. I'd like to thank those who are attending the meeting or observing the meeting in the public gallery. Let me first go through the procedures today. And let me also read out the attendance list. From the administration, we are joined by Mr. Ho Kai-ming, Under Secretary for Labour and Welfare, Mr. Fletch Chan, Commissioner for Rehabilitation. From the Education Bureau, Mr. Chen Kitling, Principal Education Officer, Special Education. From the Social Welfare Department, Ms. Maggie Leung, Assistant Director, Rehabilitation and Medical Social Services. From the LCSD, Ms. Cami Lee, Assistant Director, Leisure Services. Ms. Connie Lee, Chief Manager, Festivals and Audience Development. From the Department of Health, Dr. Rico Chu, Senior Dental Officer, Healthy Teeth Collaboration. From the Hospital Authority, Dr. Larry Lee, Chief Manager, Cluster Performance. I'm going to ask the administration to walk us through the paper, and then I will give the floor to deputations to give their views. The administration will then give a consolidated reply to the views expressed. We have many participants today, so please observe the time limit for deputations, and that's 3 minutes. There's a timer in this room. It will go off when the time limit is up, as a reminder. So please speak into the mic. Another reminder, if necessary, you can use the earpiece in front of you. Channel 0 is the floor, Channel 1 Cantonese, Channel 2 English, Channel 3 Putonghua. We also have sign language interpretation service. If need be, you may wish to watch the webcast on the screen. For members of the public expressing their views at this meeting, please note that you do not enjoy the protection or immunity provided under the Legislative Council Powers and Privileges Ordinance. The same goes for the written submissions you provide. Another reminder, in relation to the various security measures, they are set out in the notice for members of the public attending meetings in conference rooms or observing meetings in public gallery of the electrical complex, the notice has been sent to you by the Secretariat. You will also find a copy in front of you. If necessary, you can also get a copy from our security staff. Please observe the order of the meeting. Please refrain from displaying any slogan, placards, banners, and please do not shout or chant slogans. Again, these details are in the notice as I mentioned. Mr. Ho Kai-ming, Undersecretary, will now walk us through the paper. CB bracket 11291/2024 bracket 01. Undersecretary. Thank you, Chair. Madam Chair, members, deputations, this paper briefs you on the planning and provision of support services for the disabled by the government. The government is committed to supporting people with disabilities to develop their physical, mental, and social capabilities to the fullest extent and to encourage their integration into community. Different bureaus, departments have been providing a wide range of services to cater for the welfare, medical, educational, and other needs of PWDs. I will go through the work of various government departments, but more importantly, we're here to listen to your views, which will serve as our reference for our future planning. On welfare and support services, we have a range of services to look after people with disabilities, such as residential care services. There are various types of residential care services for PWDs. In March 2023, we incorporated the ratio in the Hong Kong Planning Standards and Guidelines. The planning standard is 36 subvented service places per 10,000 persons aged 15 or above. We also provide center-based and home-based community support services for the disabled to facilitate them to integrate into the community through residential and day respite rehabilitation service units. We provide respite services for family members or carers to take a break and attend to their personal affairs to relieve their stress. We also have employment training and support such as employment matching or job matching service. We provide allowance and subsidies to employers, and we also have subsidies for rehabilitation services, and we encourage NGOs to provide jobs to the disabled. We also have other welfare assistance schemes such as cash allowances and other financial assistance, barrier-free environment, and measures to facilitate travel for PWDs. Apart from those, we understand that there are other needs such as health care and also other facilitation measures for PWDs to participate in cultural, recreational, and sports activities. We have representatives from the various bureaus and departments attending today's meeting, and we welcome views from deputations. Let's hear from the deputations. So let's start with Mr. Chow Tat Hay. Madam Chair, members, good morning. I'm a social worker helping those who are physically disabled. Many of them are highly educated. Many of them would like to work, but they are also on the CSSA. Now, one of the items on the CSSA is rehabilitation and disability subsidy. And then together with other forms of allowances, altogether they get some $30,000. If they join the workforce, they will no longer be eligible for these allowances and the CSSA. Now, if they are out of the CSSA queue, they only receive a subsidy of $2,500 under the Community Care Fund. That means they must earn at least some $20,000 a month in order to meet the necessary expenses. And this is a disincentive for them to join the workforce. They want to be self-reliant. They have high education attainments, but because of their medical needs, they are deterred. So I hope the government would explore other alternatives, that is to have separate items from the CSSA or to work on the $2,500 subsidy under Community Care Fund, specifically to raise its amount. That's the first point. The other point is about community support. The Undersecretary just now mentioned that date respite services are available. The problem is, on Sundays or public holidays, there are few places available for day respite service. For example, a family may want to allow the foreign domestic helper a day off on Sunday, but the day respite services are simply not available. So the foreign domestic helper are unable to take leave on that day. The help is deprived of her own social life, and that's more stress on them, and the foreign domestic helper may not be happy working for that family. So we should increase service provision during Sundays and public holidays. Likewise, we should step up support for nighttime respite service. Even if you call 182, 183, the hotline doesn't provide a lot of support after hours. So apart from date respite service, we should also explore increasing the service provision at night time. Thank you.
Thank you, Mr. Chow. Next, Ms. Kwan Yi Chen from Concord Mutual Aid Club Alliance. Thank you. Good morning. I am from the Concord Mutual Aid Club Alliance. We are very concerned about primary healthcare policies. Since 2023, we now have 300,000 mental patients managed by the HA, and we see an overwhelming challenge here. We need comprehensive mental health policies. The current policies are not able to meet the needs of mental health patients. Right now, the ratio is 1 to 760. That is one medical staff member to 760 patients. We really need to allocate more resources to healthcare for mental health patients. We should also enhance collaboration between different sectors for this. I understand that a review has been conducted in 2017, but that was not a review comprehensive enough to identify the service gap. So I hope the government can have a long-term study that will review various aspects of the issue. I think we should have a local mental health blueprint and set up indicators, as well as have a strategy for allocating appropriate resources for support of mental health patients. Patient self-help organizations are also very important in the picture. In the spirit of self-helping and mutual assistance, we should have a network for this. When making policies, the government should treat self-help organizations as partners and include them in the policy-making process. Enhance the participation of self-help organizations and include these organizations in the consultation hierarchy in order to flesh out a support mechanism. Right now, we have a problem with the lack of venues. The SWD subsidies cannot be used for rents, and the allowance is very meager. It's not enough for renting offices anyway. So when planning for support measures for organizations, I urge the government to provide more support for self-help organizations to get permanent venues in order to provide support services to those in need. Patient self-help organizations should also be included in various structures. Right now, we have more treatment-oriented approach with things. I think we should take an approach that is more recovery-oriented in order to enhance self-reliance of mental health patients. Thank you. All right, next, Ms. So Mei Ying of a mutual aid organization for people with neuromuscular diseases and their families. Good morning. I have worked for the HKNMDA for a decade and more, and I have visited many families, and many family members have not had a good night's sleep for a long time. If they have foreign domestic helpers, it would be better, but if they don't, it's just very hard for them. And as some deputations and individuals said in the earlier session, foreign domestic helpers have to be on leave. So it would be hard for carers to actually care for their family members. It is going to cause much pressure on them. They cannot really sleep or rest. The prolonged pressure can bring about emotional problems, and many carers and the patients would actually be faced with constant pressure. So I hope the government can enhance support for patients and their family members. We do understand the government has been working hard, but it is always about the lack of resources and the allocation of resources. So I have a suggestion. Perhaps we can have the CCF provide some support so that when foreign domestic helpers are on leave, they can still obtain some services to provide some sort of support for their family members. Also, in relation to manpower and training, we should also enhance such. I've heard deputations and individuals speak about not having consolidation and coordination in terms of support. So I would suggest combining the various support schemes to provide more comprehensive support. Also, there is a special allowance for medical consumables. It is mainly for medical equipment, but it is actually the case that not many will actually need ventilators. They would only need the specific kinds of milk, but this is not covered by the allowance. So I hope that the allowance can cover such so that more people in need can be helped. Thank you. Thank you. Next, Mr. Stephen Choi. Thank you. I myself work in an organization that serves persons with intellectual disabilities. So I have some suggestions for the government here in relation to my experience. I think there should be better service coordination so that ETC courses can focus on preschool children services and OERC can serve kindergarten and primary students. Also, there should be more life planning for students. In sheltered workshops and rehabilitation centers, people working there will get $26.5 per hour, and that is not enough for living. I hope the government reviews the amount. I hope the government also takes into consideration the aging problem of mentally handicapped persons, and we should have homes that can cater for both the aging mentally handicapped persons as well as their aged family members. Also, we should provide allowance for physical checks for disabled mentally handicapped persons. Right now, it is difficult for people to obtain work for mentally handicapped persons. And recruiting for our organization is actually very hard because we do not have professional recognition. So we should be provided with professional recognition, and that should help with our recruitment. Thank you. Thank you, Ms. Chen Chun-Yung from the Hong Kong Society for Rehabilitation Community Rehabilitation Network Cornhill Center. Thank you. I have some suggestions in relation to carers. I have been in touch with many carers. I can see that they face great pressure. We do see the government providing more support for carers. We have the carer hotline as well as the carer support network. But carers are still faced with challenges such as they do not receive adequate support and do not receive appropriate recognition. So we suggest that we should have legislation and proper strategy for the support of carers. We can refer to examples in other places such as Taiwan and Singapore to have a clear definition of carers and differentiate between different types of carers and formulate an overall strategy to make sure benefits are provided to carers and provide adequate recognition for carers. Carers are very important in the caring for those in need, so we really need to think about their carers' needs as well. Right now, we should really have a data analysis of the number of carers and set up a list of carers so that we can provide the right support to those in need. We should also do more in relation to having the private developers have more social welfare premises in their developments. That would really help enhance services for those in need. Right now with respite services, it is lacking. We need more places. We should also enhance the relevant services in order to meet the emergency needs of carers or disabled persons. For example, when foreign domestic helpers go on leave or when there is some sort of emergency. I do understand the government is doing more about high-risk carers. With the support of high-risk carers, we can not only rely on care teams or existing support, we need targeted intervention. So I suggest the administration to provide intervention to high-risk carers that are specific to that group. I also urge the government to make sure there is recognition given to carers, for example, carers leave or carer-friendly policies, so that carers can be better supported in the community. Thank you. Thank you. We have now Mr. Wai Kin Yip from the Hong Kong Society for Rehabilitation, Easy Access Travel and Transport. Thank you. In 2021, we have a roadmap for electric vehicles and existing diesel fuel vehicles will be phased out by 2035. To tie in with the development, we should have more barrier-free vehicles. These are solid foundations for that. There is much room for improvement in this area at the moment, especially for barrier-free transport for disabled persons. In the Southern District, we have had for 5 years a rehab bus pilot scheme, and we have over 60% of them, the users, being disabled persons, and we have had a growth in the number of users, so we can see that there is a demand for such services. I urge such services to be regularized and promoted to other services as well. It is said that in 2025 we will have a blueprint for transport and logistics for disabled persons, and it is also suggested that we should increase the ratio of barrier-free vehicles. We should have a cross-departmental group that will involve transport operators, and there should be coordination in order to enhance administrative efficiency. I also suggest that we should include the wheelchair fare in the taxi fare table so that it will be regulated and it can be adjusted when needed. We should also provide transport vouchers for disabled persons so as to reduce the burden on disabled persons in relation to using barrier-free transport. I also suggest the government gather big data on the traveling patterns of disabled persons so as to allocate resources rightly to match their needs. Well, that's it from me. Thank you. Thank you. We next have Ms. Chen Kwan-ning from the Hong Kong Society for Rehabilitation Center on Research and Advocacy. Thank you. I have some suggestions. Right now, we have 1% of the population being disabled persons. As we have an aging population, we will have more of them. We should really do more in terms of barrier-free access so that different groups can still have their sense of belonging in the community. We welcome the Buildings Department in incorporating the concept of universal design in the Design Manual Barrier-Free Access 2008. I suggest that there should be more guidelines and general standards put in place. I also suggest that there should be guidelines implemented in government projects so that it will be promoted to other private projects as well. We should also consider user experience in reviews of guidelines. For example, accessible toilets ratio and incorporating standards in standards that are to be complied with, as well as proper design guidelines, so that we can make sure the guidelines are updated as well as enhance user experience for the disabled. For those in need, we need to make sure there is representation in the planning for projects early on so that we will make sure there is barrier-free access for them. MTR system is widely used by disabled users, but in Central there is only a lift, and in Lambton Station in particular there is no lift that would provide access to ground level. Some members did express concerns, and in fact our society has expressed concerns about this specific issue, and we will provide rehabilitation services in the sense that we can provide access to the MTR station. The center will be completed in 2029, and we should be able to allow for more access of disabled persons, some 300,000. So I urge the government to put in a lift in Lambton Station to make sure there is access for disabled persons. Often disabled persons are also faced with digital divide, and there should be long-term policies to minimize that divide for disabled persons as well as elderly persons so that not as many of them would be left behind. We have more detailed suggestions in our submission. Please refer to it. Thank you.
Thank you. Next one, Ms. Tang from the Concerning Home Care Service Alliance. Thank you, Madam Chair. We are an advocacy group. I have a couple of points to share. For daycare respite services, the usage rate is quite low. For daycare services, it's below 15%, whereas for the other kind of service, is even below 5%. There are several reasons, and I'd like to share them with the administration. One, the planning of resources is not even. In Eastern District, Wan Chai, Yau Timong, there are only 3 quotas. In the Southern District and outlying islands, there are only 2. So, when there is a service demand, then they may have to cross the district to enjoy the services. On some occasions, they may have to give up on the services. So is it possible to expand the ratio so we can accord the ratio according to the population structure? There's a vacancy inquiry system. It's online, but there is no booking system right now. So is it possible to make an improvement from this perspective so that the system, the booking of the services will be accessible? The administration should mount publicity on radio programs, for example. They can step up publicity so that more people will know about the provision of services. I'd also like to share about the respite services. The accessibility and diversity of respite services are on the low side, so we look forward to a consolidation and improvement of the services. For some services, you need to go to centers yourself, so is it possible to provide services that is door-to-door services, outreach services? Will the administration study the possibility, the viability of these services so that more people will benefit from these services? Some PWDs are taken care of by domestic helpers, but domestic helpers will also have leave. What happens to PWDs when they feel ill, when their domestic helpers are not with them? I hope the administration will respond to these points. We have more points, but other members of the alliance will share in a moment. Next, Ms. Yip. I'm also from the Concerning Home Care Service Alliance. Residential care homes for the disabled have a waiting time of 3 to 5 years. In between, support services should be provided, but statistics show the quota for home care service for persons with severe disabilities is insufficient. In 2021 to 22, there was no increase in service quota. There were only 245. The figure stayed the same all along, so it's insufficient. Home care service contents are not comprehensive enough either. For home care service, there is no meal delivery. The elements only focus on rehabilitation. So PWD's demand in the evening and on holidays are not catered for. It's also confusing to PWDs. In society, there are district resource centers to provide assistance to PWD, but for those above the age of 65, they are not covered. They can only go to elderly service center, but these centers cannot provide assistance to PWD. They are not tailor-made enough. So can you provide more quota for home care service for PWDs? Can you provide round-the-clock support? There should also be more assistance to be provided by district support centers. At present, carer services PWD carers should also be taken care of. We should provide more assistance. The services provided are quite fragmented. There has been a demand in the community for the administration to provide a one-stop carer support center, which will disseminate information as a one-stop shop, making it easier for carers to apply for services. This will also provide a breathing space for carers. This will also provide a carer-friendly environment in the community. Next, Ms. Lam Chan. Good morning, Madam Chair. I'm a carer of a child. I'd like to talk about round-the-clock support services. At present, there is no emergency support services for carers. When we cannot provide caring services, it is actually difficult for us to identify a residential care home. These centers mainly provide daycare services, but in the evening, there's a lack of services. I can only go to hospital in the evening when I need help, but hospitals should provide assistance to those with emergency needs. Instead of providing services for PWDs, the hospital should provide 24-hour care services. There should also be outreach services and door-to-door services. Expenditure includes medical supply cost, transportation fees, and so on. Financial support matters to us, but the threshold at present is really high. We cannot take the initiative to make an application. We cannot enjoy double benefit. For example, if one is on CSSA, one cannot apply for other kind of benefits. One cannot reimburse the fees as a result of caring for others. So I hope that the administration will adjust the threshold so that carers will find it easier to apply for expenditure reimbursement. Right now, there are indeed operators pick-up call in relation to emergency support hotline. I'm old now. My child has grown. Most of the time, I'm afraid I cannot take care of my child in case anything happens to me. I'm not sure where I can send my child to. My child is 24 years old. If I'm not with my child will be worried about me. So I mentioned emergency support. I've been talking about it for a decade or so. I hope this will be made available before I pass away. Many parents like us find it difficult to care about and care for our children. It's mentally draining to us. Thank you, thank you. I hope you can cater for our needs. Thank you, Ms. Lam. Next, Ms. Fong. Good morning. I'm also a member of the Concerning Home Care Service Alliance. I'd like to talk about supply of residential care homes for the elderly. As at end 2023, statistics showed us rehabilitation services were lacking in society. On average, the shortest waiting time took 5 years and is already short. It may take as long as 14 years. It's such a long wait. As a parent and as carer, we have pressure, we have a burden. How should I put it? It cannot help carers at all. We need to rely on the help of residential care homes. With such a burden, if family members cannot wait for a place in residential care homes, one can only turn to private residential care homes. The burden is indeed too much. But as we know, the care provided by private residential care homes is not sufficient to care for PWDs and those with severe mental disability. Under the SWD, I understand there is a committee on the quality of residential care homes. You indeed need to look into the issue. That is, how can we improve the quality of residential care homes? You need to discuss with residential care homes. You need to seriously look into the issue. How can we better plan the manpower working in these care homes? You need to look into procedures as well. You need to replan manpower supply and the manpower required. This will make it easier for you to take on manpower and can enhance the quality of care homes. 8 square meters for residential care homes, but you also need to help train carers in residential care homes. For example, in the midst of the epidemic, we all saw the problems with residential care homes. So the quality of care homes is close to our hearts. Should we lower the threshold? And should we, for now, pause the application? Well, you should help train the staff members in private residential care homes, and you need to seriously consider improving the quality of residential care homes. Otherwise, without any improvement in the services of private residential care homes, members of the public will not consider sending their family members to residential care homes in the private sector. Then the wait for a place in public residential care homes will only become longer and longer. This will not solve the problem. You need to improve the quality of private residential care homes in order to solve the problem we face right now. Thank you. Ms. Chang Lai-sung. Thank you, Madam Chair. I'm 77. My husband is 85. He suffers from a chronic illness. Right now, he can still move around. He can go to the hospital for checkups. He can go to buy medical supplies, medical equipment. But we are worried if one day his physical conditions deteriorate and he cannot take care of himself, we will need more time to take care of him. I may not be able to do it myself, so I'm worried that we don't have anybody to help us out. Right now, the government's requirement is that one cannot apply for carer subsidies if one is already enjoying OALA. We are elderly persons, but it does not mean that we are not carers. It does not mean that we do not have to look after our better half. The medical expenditure has cost us a lot. I hope the government can lower the threshold for carer subsidies. Well, please switch off your mobile phone. Thank you. To allow carers to receive sufficient support. Thank you, Ms. Chang. Next, Ms. Lee from Baptist Oikon Social Service. Madam Chair, good morning. I recovered from an illness. I received services from ICCM. In half a year, the progress was satisfactory, so I was hired as a server. I have two suggestions to make. One, on publicity. As a volunteer active in stepping up publicity, I understand there is still misconception about volunteers. So people may be turned away from seeking services from ICCM. ICCM has been publicizing its services, but it's not easy to ask the public to accept persons in mental recovery. I hope the administration will expand more resources on massive publicity to help ICCM to enhance public awareness. You should draw reference from Hotline Shall We Talk. You should also prepare, for example, television clips, advertisements on public transport. I believe this will step up publicity so that we can early identify cases that require help so we can provide assistance as early as possible. In relation to housing supply, the ICCM has been facing challenges with public and private partnership in relation to housing. In this case, the services cannot reach the grassroots, so I hope that the administration will step up publicity in this regard and build a network targeting 3 new buildings. For example, you can have posters, you can have kiosks, stalls to provide assistance, so members of the public can seek assistance, and these services will help enhance publicity about these services. Thank you for giving me chances to share my views. Thank you. Thank you. Next, Ms. Tang Hu Yan. Thank you, Madam Chair. I'm Hu Yan. When I was 1, I was diagnosed as a spinal disease. I cannot stand still and I need the help of a carer. At present, I'm a registered social worker in a self-help organization. I graduated from Lingnan University. I worked in new territories companies earlier on. But I found that some problems couldn't be solved with money, so I chose to work as a registered social worker. On employment support, there's an improvement, providing assistance to help PWDs to look for jobs. There's also assistance in the commercial sector to help, such as DEI. There's assistance for carers, and there should also be assistance about electric wheelchairs. Without these, we would be nothing, meaning that we could not live on our own. We cannot take care of ourselves. On carers, I have a foreign domestic helper. If she falls ill or if she needs to go back to her own country, we'll have to look for respite services or hospital services. There's been a lack of or shortage of respite places. There's also a lack of a comprehensive plan. Hospitals should be for people who fall ill. But why should I have to go to hospital? I just don't have a carer to take care of me for a short period of time. Why should I go to the hospital? Owing to my physical condition, I need an electric wheelchair that is expensive. I need a wheelchair that costs $120,000. I have subsidy of $60,000, but I'm still $60,000 short, and I need to think about it. How can I seek sufficient fund? In relation to part-time carers, in case I don't have the help of my foreign domestic helper, I still need the help of a part-time carer. For round-the-clock carer support, I also want to see support services. I hope society knows we don't aim at living by. We are not just surviving. We need to live.
唔該。
Hi.
Next, Mr. Zhang Kai from the Barrier Free Concern Group of One Step Association. Good afternoon, everyone. Now, barrier-free access is something really close to my heart. I have been following up on this issue for over a decade. I'm now an ambassador for an organization in this regard. I think the government has not been doing a good job in providing barrier-free access. The progress is so slow. Just take a look at street shops. Many of them are not accessible to wheelchair users. We have restaurants in Wan Chai, Causeway Bay, and in Mong Kok. And the ground level shops are not providing barrier access to wheelchair users. The government should lead by example. The government should put pressure on shop operators to make sure that they provide a barrier-free environment. They should be penalized otherwise. Or the government could take up the works on their behalf and recover costs from them afterwards. We need to enact legislation to ensure the provision of barrier-free facilities. That's the case for street shops. For shopping malls, they are doing quite well. The other point is about transport. For tourist coaches and coaches for residents, again, they are not serving the disabled. We should make sure that a certain percentage, say 25 to 50% of the services should be provided for the disabled as well. Again, the government should take the lead in this regard. Public light buses. I'd like to turn to that. The trial was implemented 10 years ago, and so far only 4 or 5 low-floor public light buses are available. Not to mention barrier-free taxis. The situation is really outrageous. The wheelchair-bound is really need barrier-free taxis. They are unable to afford other forms of expensive services. They need the transport to help them visit friends or go to clinics, but it's really costly. Please help us. Thank you, Mr. Zhang. Next, Ms. Tam Siu Ling, representing the Healthcare Reform Group of One Step Association. Thank you. I represent the One Step Association as well. I suffer from chronic illnesses and I need medication to keep myself alive. For those on DA, be it higher or normal DA, the medical fees should be waived. At least this can help lift the burden off our shoulders as we visit clinics. Now, in order to be eligible for the subsidy, a family-based approach is adopted in the vetting process. I hope it can be relaxed to individual-based vetting so as not to cause disharmony in the family. A family-based application threshold may cause more bickerings among families. Some family members may need to give up their jobs. So this may cause or drive a wedge in the family. I'd like to turn to medication now. I have sclerosis. This is a kind of a skin disease. I've had it for a decade, and I have been following up on this condition at the hospital. All along, I've been told by doctors that this is an incurable disease, and it's really causing a lot of pain. I become socially withdrawn. I don't want to go to anyone's homes because the skin cells that, or the tissues that fall off from me is really a horrifying scene for children. They don't want to take a seat after I've taken it. Recently, I have turned to a bile agent, and I had the third injection, and immediately I became another person. The old condition was gone, and I also resorted to hydrotherapy. I was advised by the therapist, but I dared not go because of my skin condition. But now in March, I started to receive hydrotherapy or aquatherapy as well. It's really a relief for me. This year, I can even visit the children that I've been supporting in Poland Cook. Now, I want to talk about medication because this injection is really costly. Each dosage costs $20,000. This is a rather common disease because of stress in urban life. I hope that this can become a generic drug for more people to use it, because I don't think many people can afford the costly treatment. Next. Ms. Ko Kwan Lai, also from a group of the One Step Association. Good afternoon. I represent the concerned platform for non-CSSA recipients of One Step Association. I'd like to share the following story with you. In Hong Kong, there are 177,000 people who are on either the normal or high amount of disability allowance. They are not on the CSSA dole queue. And we also have elderly people and other disabled members of society. Many of them live with their family members, like myself. Because of the savings they have yet to turn to the CSSA queue, or they are not eligible. At the moment, they could barely make ends meet. Some of them are able to pay for living expenses, but not for other major expenditure items. Now, I suffer from a rare disease. One Step Association once conducted a survey among the 183 wheelchair users in a 5-year period. on average, they need to pay for $33,237 on the cost on the maintenance and repair of wheelchairs. Many of them already spent $90,000 or more on medical equipment and consumables in the 5-year period. For non-CSSA recipients, they may need to pay, say, $40,000 plus on the respirators and also some $35,000 on wheelchairs and the ceiling hoists, $21,133, and also $11,000 plus for a non-electric wheelchair. We also need medical consumables such as diapers, tubes, urine bags, also some really expensive medical consumables for testing the blood glucose level for diabetic patients. These are really expensive items. Now, I suffer from a rare disease, and recently the motor of my electric wheelchair broke down. I have to buy another wheelchair, and that will cost me $80,000 because I'm physically disabled. $80,000 is a really huge burden on my family. For the severely disabled like myself and Hoi Yan, we need a family minder like my sister to go out and about, to socialize and to visit the doctor. And we pay for all the expenses, including the expenses for my foreign domestic helper as well. The transportation fees could be as high as $2,500. That's about the amount covered by the traveling allowance. And then we also need to spend most of the $4,000 subsidy to pay for medical items and consumables, not to mention other expenses. So I'd like to take this opportunity to tell Undersecretary and other members that on this front, you should look after the disabled, because these are the necessary expenses to keep us going. I hope that the Subcommittee on Issues Relating to the Support for Persons with Disabilities can seriously consider all these issues and provide support to our group. Next, Mr. Chiang Ka-sing, Social Security Group of One Step Association. Right, is it coming through? Yes. Under the Community Care Fund, the government provides a subsidy for recipients of higher disability allowance to hire a foreign domestic helper to improve the living quality. Now, that is my case. I suffer from a chronic disease. My mother is in her 80s. She had a stroke, and I have to take care of her. I am the only person who has a job in the family. She also is a chronic patient. Now, we receive only a meager income as a clerk. Now, I have a family of 3. We all need care, so we need to hire a foreign domestic helper. Much of the allowance goes to paying for the foreign domestic helper as well as meeting other living expenses, especially health care. In our family, health care expenses could be as high as over $10,000. Now, because of improper sitting posture. I suffer from joint inflammation, and it costs over $1,000 each time to treat my problem. So I hope that recipients under the item of the CCF can be provided with more assistance. Now, even for those receiving higher disability allowance, not in paid employment, we should receive the subsidy as well, because as mentioned by other deputations, we need to pay for the carers and other expenses. We enjoy the $2 transport concession, but we don't have anything to cover the expenditure for the foreign domestic helper. So please help us. Thank you. Next, Mr. Kam Sin, representing the barrier-free group of the South One Step Association. This is a society that is inclusive, so to speak. Is it really true? I don't think so. The disabled are not included. That is because of barriers between the able-bodied and the disabled. The conflicts should have been avoided. There should be respect and mutual understanding. Now, for the wheelchair-bound, some of them think that they should enjoy certain priorities, and that the able-bodied should give way to them. On the other hand, the able-bodied passengers are disgruntled because the wheelchair users could be first in the queue when boarding buses, when other people are hurrying to work. We should put ourselves in other people's shoes. Now, take public transport as an example. We have the same queue waiting for buses at the bus stop, but during rush hours, some bus captains may ask passengers to get off the bus for a wheelchair user to board first. This practice is questioned by the able-bodied. These passengers are also in a hurry. They don't want to give way to the wheelchair user. We should avoid having this conflict. The government should talk to bus companies. In fact, for bus companies in other places such as the mainland, wheelchair users could board the bus using the middle door. You can just pull down the ramp for wheelchair users, and then normal passengers can use the front door. That way we can avoid having a dispute, because nowadays we have low-floor buses. But after all, it depends on by how much the driver would lower the floor to help wheelchair users get on board, whether they are willing to do so. In some cases, the wheelchair may flip. They may not be able to get on board. You should tell the bus companies to procure a specific model in order to make it more accessible for wheelchair users. So that's food for thought for stakeholders. We need improvement. You should not just follow old practices. Well, yes, you have barrier-free, low-floor buses now, but more should be done. It's for the bus companies to do so. The government should also issue guidelines for bus companies. For example, that after you've procured barrier-free models, you should walk the extra mile to make sure that this is properly done. Don't just follow your old ways only because it's been practiced for over a decade, because it's a waste of time and manpower. I hope the government would pay heed to that.
Thank you. Next, we have Ms. Lamson Mann from Concord Mutual Aid Club Alliance. Good afternoon. I am from a self-help organization for mental health patients. We had staff members increase from 30 to 40, now 70. These are positions for mental health recovery persons. Some can work until they even retire. So it shows mental health recovery persons can work. All that is missing is an opportunity provided to them. So we should have people who can help them adjust, such as for ICCMWs, they will have counselors and other support personnel that can help them tackle the challenges that they may face in the workplace, that can help them adjust. But these should not be short-term, and these should be one-to-one until recovery persons can actually get used to work life, and then they will work that job for the long term. So that they can realize their dream of being self-reliant. For persons in mental recovery that cannot work at all, if they have to stay at home, since we have advancements in technologies, we can probably provide some AI tools or some other kind of support that can allow them to work at home. We can work with social enterprises in this. On arts, we need to make sure that we can facilitate planning by persons in mental recovery so that they can actually feel happy in life and they can get satisfaction from work. I also hope the government will be an example by hiring more persons in mental recovery so that private companies will also follow suit regardless of their skill. With the latest technologies, we should be able to compile statistics on disabled persons and find out the distribution. In doing so, that will help us with our manpower planning. With technologies, we can alleviate manpower shortage through resource allocation. There should also be better departmental coordination so that there is better medical, school, transport, labor and welfare, as well as police collaboration. If there can be a one-stop hub for persons with disabilities to communicate with these different departments. Also, RPP has been implemented for several years. I hope that there can be a short, mid, long-term review of measures. Work hours are often too long. It has really harmed families in the sense that they can't really share about their lives in spare time, not to mention childbearing or further education. we need to give more time for families so that we can actually reinforce the core values of families. We should give families enough time so as to minimize conflicts and promote harmony. We want to have everyone live in peace and prosper and have hope for the future. Thank you. Thank you. Next, Ms. Ho Shuk Ching from the Association for the Rights of Hearing Impaired Students, ARHIS. Thank you. The ARHIS fights for the rights of the hearing impaired students. Many of the parent members want their children that have hearing impairment to listen to what is being said, to hear what is being said and get good education. I would say, one, we should provide subsidies for cochlear implants. While the government will provide free cochlear implants surgeries for the first time, the maintenance period would be 10 years, but the language processors and components would only have a maintenance period of 3 years. Once the maintenance period expires, parents would have to replace the equipment at their own cost, and it would cost $50,000 to $70,000. Even if they only choose to repair such equipment, it would still cost thousands. So it is a great financial pressure on parents. I hope the government can provide more support in terms of providing financial assistance to replace language processors. Also, there should be financial subsidies for the purchase of hearing aids. But right now, the quality of hearing aids available can really vary. It cannot really help with students' understanding at school. It doesn't really help them hear, speak, and learn. In order to meet the expectations of parents, they no longer purchase hearing aids available from the Education Bureau. They go on to purchase personalized hearing aids. This is, of course, an increased cost, and I think that would be a misallocation of public resources. So we urge the Education Bureau to provide this kind of support in the form of cash subsidies so that parents can purchase the right hearing aids for their children. Also, we ask for financial assistance to be provided to patients with microtia, because students with microtia, they have to have inserted implants made, while the hospital authority does pay for the surgeries. But the sensors would have to be purchased by parents, and it would set them back tens of thousands or even over 100,000. This is a significant cost for families. So we ask the government to subsidize the right kind of equipment for students with microtia so that they can integrate into schools and in the end communities, and that will alleviate the burden on the students and parents. Thank you. Thank you. Next, Mr. Eddie Soon from SAHK. Thank you. The Social Welfare Department, in relation to the RPP published in 2023, has provided a community support service pilot scheme, and the SAHK has successfully won the tender rights for Integrated Community Rehabilitation Center in New Territories West. We have commenced services on 1st of September last year, and we have provided 4,000 sessions of rehabilitation therapy and care services for disabled persons in the community, more than 120 of them since then. And we have achieved our indicators in both persons served as well as the number of sessions, and it also reflects the great demand for such services. There are 3 benefits to the Integrated Community Rehabilitation Center operational model. 1, we have a one-stop shop for services, and in the past 20 years, we have been operating on a self-financing basis, some consolidated centers. We want to provide continuous service through such. Right now, with the subvention of Social Welfare Department, the day rehabilitation center and home care services in the same districts are often provided by different organizations, so service users often have to go to the 2 different units to obtain services that they need. There is not much coordination between service units, so service users have to repeat their needs and their arrangements that they need to 2 different service units, and it has brought about inconvenience and pressure. But luckily, the SAHK operates both services in New Territories East, so there was good distribution of work as well as coordination. We managed to provide comprehensive care services for service users. On 28th of September, the chief executive visited our Community Rehabilitation Center in New Territories East and has visited some service users to listen to their views. Also, we have had another service team that has shared their experience with the chief executive in relation to some on-site services. Service users, family members, as well as the chief executive agree that we have been doing good work. And in our experience, we have seen that consolidated services can really better meet the needs of disabled persons, and it also allows for the flexible allocation of manpower and resources. The ICRC has 2 other features. We have been making good use of technologies. We have also been making use of a model with the International Classification of Functioning Disability and Health, that is a WHO framework that will allow us to really formulate service plans for users. 100% of the service users were satisfied with our services, and they believe the new model brought about some good changes to services. So we urge the Social Welfare Department to regularize such services, and in daycare centers and day home care services, there should be some overhaul so as to provide one-stop care for our service users. Thank you. Thank you. Last to speak, Ms. Edith Hong. Thank you. I'm also from the SAHK. Mr. Xun has already spoken on behalf of the association. I have nothing to add. Thank you. All right, thank you. We have had 23 deputations or individuals speak. I will now invite the Undersecretary, Mr. Ho Kai-ming, to provide a brief response. I will also invite other representatives of the administration to supplement the response given by the Undersecretary. Well, I would first like to thank deputations and individuals for attending the public hearing. I have jotted down some points. I want to particularly respond to what Ms. Ching experienced. Well, there are many types of homes for persons with disabilities. We have tried hard, but we still have a relatively tight supply. Regarding what Ms. Ching said about her having to live in residential care home for the elderly, if she wishes to live with her husband, she does not have to make use of local services. In the Greater Bay Area, there are actually 2-person rooms. So not only can you care for your husband, you can enjoy the care of the home while living in a 2-person room. And that should reduce the pressure faced by you. So we do not have to limit our options to home care services or care allowance. I think to resolve the problem you face, it's not just about giving you $1,000 to $2,000. That cannot solve your problem. I think there are better solutions to relieve the pressure you face as a carer. But I'll let my colleagues respond to the other points. Thank you. Commissioner for Rehabilitation, Mr. Fletch Chen. Thank you. The government has allocated many resources for rehabilitation services. There are new models and new types of services for the different types of services because there are constantly additions. It may be the case that the interfacing is less than ideal, or there is something that we can really rationalize. I thank deputations and individuals for raising some pain points, and we will definitely review those. And we will also see how we can rationalize the services that we provide. For example, for home rehabilitation services as well as center-based services, how we can better interface them so that the process would be smoother. We will work on that. We have also heard deputations and individuals speak about emergency support services. As you know, we have a care hotline 182-183. It is a round-the-clock hotline. If you need to, please call the hotline. We have social workers manning the hotline and recommend the right service for you. But of course, for special cases, they may not be able to provide help right away. But please do so anyway so that we can review whether we can provide more appropriate services. Let me emphasize again, if you need to obtain support, 182-183 can provide some immediate support. Thank you. Ms. Maggie Leung, Assistant Director. Thank you. Some mentioned that the support has increased for those working in workshops have increased from $26.5 to $33. That is something that I wish to clarify. And we do understand that there may be a need for emergency respite services during nighttime or during weekends. Right now, there are 650 daytime respite services, and there is room to provide services on Saturdays, Sundays, or during nighttime. For those organizations that have participated in the Board Place scheme, they can also provide daytime respite services during weekdays. Apart from the 182-183 hotline mentioned by the Commissioner, apart from having social workers man the hotline actually serves to make referrals to service units. And they also have outreach support for emergency cases. If you have some urgent needs, you have to be away, you can make use of the care hotline to get some support from social workers. They may even be able to arrange transport services for you to get to the respite service units. On mental health, the government has been doing much to promote mental health. In March of this year, we have worked with 24 mental health centers in Hong Kong. we had a week to promote the services of the different centers. With mobile vehicles traveling around Hong Kong, we have also been promoting mental health services. We also offer some preliminary screening so that it can enhance public awareness on mental health and can get in touch with some social workers. That's it for me. Thank you.
From the Hospital Authority, Dr. Lee. Thank you, Madam Chair. I have something to respond to questions put by participants in relation to ICCMW. Mental health service centers would have open weeks, but above all, to improve the quality of the services, the ICCMW will work with the Psychiatric Department of Hospitals. The Central Coordination Committee will on a regular basis conduct reviews. For psoriasis, some drugs have already been included in the drug register, and they are within the safety net. If it's financially capable, one can of course buy the drugs themselves, or one can also seek help from the Samaritan Fund. On mental health, I'm not going to specifically talk about education, medical and social collaboration. The community psychiatric nurses will improve and enhance the services. We hope the ratio will not surpass 1:40. We are doing our best to deal with patients that are of moderate risk and high risk. For cochlear implants, I don't have detailed information at hand, but in relation to the fees, I will follow up on it with the Education Bureau. So I thank all participants for your views. Next, from the Education Bureau, Principal Education Officer Ms. Chan. Thank you, Madam Chair. On life planning of school leavers, the career prospect and life planning of school leavers are close to our heart, especially those from education special schools, Counseling activities should be provided every academic year. There's a briefing section for the career pathways for school leavers of special school. We have representatives from the VTC, for example. There are also representatives from the Labor Department. That is to help teachers to have the most updated information from 2017 to 18 academic year. The VTC had meetings with schools, special schools, The latest developments will also be related to special education schools. The aim is to provide more suitable and appropriate support for school leavers. And we'll follow up on the information to be provided to the hearing impaired. Members who would like to speak, please press the button to request to speak. Our meeting is scheduled to end at 1 p.m. and I propose to extend the meeting by 10 minutes to 1:10 p.m. Those who would like to speak, please press the button to request to speak. 3 minutes each. Deputy Chair Dr. Tick. Thank you, Madam Chair. I thank 23 participants of the meeting. Thank you for coming to share with us your views. And I look forward to a written response from the administration based on the views expressed by participants. We can explore how we can grapple with this situation and a problem. A few participants mentioned accessibility and barrier-free access. I talked to the Commissioner for Rehabilitation. We compare notes about accessibility and barrier-free environment, and we'll follow up on improving the barrier-free environment. The Commissioner is also proactive in this regard. We conducted analyses for buses, MTR, public light buses, ferries, coaches, and so on. Even for ground stores, quite a lot of places are not convenient for wheelchair users to access. There seem to be many ramps, escalators, elevators, but there are many obstacles in relation to access by wheelchair users. I hope that the Commissioner can think about how to deal with the problem. Please talk to public organizations and to formulate mid to long-term proposal and work plan so that we can enjoy a barrier-free environment. That is because a barrier-free environment is closely linked to employment. A few self-help organizations mention subsidies. If self-help organizations can fare well, they can help the government in the end. It's not the first time I heard about the problem with the location of the organization. 5% of the public housing will be dedicated to social welfare use. My suggestion is to provide social welfare services with some areas. Some officials mentioned 182, 183 in relation to support for carers. It's good, but after a period of time, we need to think whether more should be done. In the community, one-stop support services should be provided. I understand there are some funds that support these services. I hope you can think more about this. Apart from the hotline, there should be pragmatic services, more targeted services to help carers. Thank you. Next, Mr. Orin Kong. Thank you, Madam Chair. Many participants have shared with us their views, and I have something to follow up on with the administration. First of all, I thank all participants. Just now, Hiu Yan mentioned the difference between surviving and living. We're here the whole morning. Is it even easy to just survive? And how to live with dignity? How to live a better life? If PWDs do not live a life with dignity, we don't have to talk about living with a sense of well-being. PWDs should also enjoy a sense of well-being and a sense of gain. I'd like to ask about public education. A few participants mentioned the public label on PWDs. In the past few years, I'm not sure what the administration has really done on public education. In society, PWDs are considered not capable, or they are considered emotionally not stable, or they are even considered dangerous. So what has the administration done in relation to public education? A few elderly persons mentioned elderly person caring about elderly person. One of the elderly persons who shared with us just now was on the brink of tears. If she passed away, who will be there to take care of her better half? Can the administration give an undertaking so that they can, elderly persons do not have to worry about caring about the other, caring about their partner even if they pass away? The administration has been encouraging the commercial sector to provide opportunities for PWDs. Apart from simply encouraging them to do so, what will you do to promote these opportunities and to widen the equal circle for PWDs? I'd like to ask the Education Bureau. For school leavers, after they leave school, do you follow up on their career path? If you do not follow up, how can you be so sure that what you have provided is helpful to them? Next, myself, I thank the 23 representatives who come to share with us. My heart also sank while I was listening to your submissions. Much was about support in relation to mental health. Elderly person caring about elderly person, PWDs caring about PWDs. In terms of long-term policies, I hope the administration will reply in relation to providing detailed support. Long stay home, ICCW. How can we eliminate discrimination against PWDs? This is very important. It's not easy at all for PWDs to look for jobs, and I want the administration to reply regarding commuting or going out. Restaurants are not wheelchair user friendly. Buses, minibuses, they are not wheelchair user friendly either. The manual will be updated. That is, the design manual for barrier-free access will be updated. Is it possible to discuss with the catering giants? We can make it more convenient for wheelchair users. Even for public light buses, well, it may be more difficult for PLB, but what about rehab bus? It may be easier. For recipients, non-recipients of CSSA, there's a problem. It doesn't crop up overnight. It's been discussed for a period of time. Transportation fares have taken up a certain proportion of the subsidies they have. In the Community Care Fund, CCF, is there any room to provide even more resources? Would there be any schemes to help them? Next, about RPP. In the meeting, will we conduct a review of RPP? Will we follow up on the implementation of the program? Next, in relation to home care service for persons with severe disabilities, I'd like to ask about review. Will there be more resources to be provided? These are my questions so far. First of all, Mr. Ho Kai-ming, Undersecretary. Thank you, Madam Chair. I'll speak in brief. My colleagues will then supplement. In relation to the home care service for persons with severe disabilities, we can discuss that in the panel meeting. Well, what happens when the family member of persons with severe disabilities passes away? Well, first of all, persons with severe disabilities can go to our care homes. The SWD has commissioned some organizations to establish funds. If they have their own resources, they can entrust organizations to take care of their own children. We have also sought assistance from these organizations to act according to the wish of the family member. We are working on this. There's an aging population of PWDs. It's the recent phenomenon. The turnover rate of residential care homes is on the high side. Medical technologies weren't as advanced. In the last decade, with more knowledge and with more resources, we do need to think about the planning about how to tackle the aging population of PWDs. Mr. Fletchan, thank you, Madam Chair. The problems you mentioned are major problems, and we have already had relevant agenda items to be discussed in panel meetings, such as the commuting issues among PWDs. I may not be able to delve into these issues in this public hearing. The government has been working on it. On new facilities, universal design has been faring quite well. This is especially so in new districts. In older districts, there may be steps in older districts, making it inconvenient for wheelchair users. They cannot access certain areas. So how can we deal with this problem? It's not that easy, actually. First of all, in areas where there are ramps with steeper slopes or with narrow paths, it may not be that easy to access all places. So is it possible to discuss with shopping malls? Can we discuss with catering giants? For restaurants that are larger, they may be willing to do so, but we have a lot of fast food restaurants or cha-chan tanks. We need to make it convenient for wheelchair users, but it may not be that easy for all cha-chan tanks or fast food restaurants to accommodate wheelchair users. We need to strike a balance. We want the entire society to be willing to walk the extra mile to do so. But we need to know our limits. We need to know what we are capable of doing. Just now, public education was also mentioned. We have had different publicity events on different levels. For instance, on media publicity, television API, there was much publicity about being inclusive. NGOs also helped with publicity. There's also publicity at school levels. We want to have education for school kids since they are young. It's no easy task to fare well in public education or publicity overnight. We may need to do it on a regular basis. We need to hammer home these messages. We cannot just convey these messages once. Some participants mentioned PWDs may not want to identify themselves as PWDs as a matter of labels. Mr. Rincon mentioned Eco's circle. It may be a good idea, but we need to think about packaging this idea. The purpose is to avoid any labeling effect. That's my response for now, and we can look at the details later on.
The Assistant Director Leung. On self-help groups, every year we disburse up to $20 million to self-help groups to build networks. Apart from government subvention, through the Hong Kong Society for Rehabilitation, we also build rehabilitation centers at the district level. These centers can also make available space for the self-help groups to organize activities. about having premises ready for the groups. Depending on individual cases, we will talk to the groups and see how we can enhance support for them. Ms. Chen from Education Bureau, thank you. Thank you, Ms. Kong, for her questions in relation to follow-up work in relation to special school leavers. Within 2 years after the student has left the special school, our social workers will continue to follow up on the situation, including how well the student is adapting to social life. At the time of leaving the school, the social worker concerned would also refer the case to the Integrated Family Service Center and the Rehabilitation Center for the Disabled to provide continuous support. Now, this year, we also roll out a special scheme for outreach teams to provide services to special school leavers and their parents. They will be given information and support to alleviate stress on them. We can also help students adapt to life in the community. This dedicated team will also closely communicate with their counterparts so that a more swift channel can be provided for the referral of services. Anything from the hospital authority, Dr. Lee? Yes, on mental health, with the joint effort of the Advisory Committee on Mental Health as well as the hospital on Health Bureau and the Hospital Authority, we address the issue of stigmatization. But let me add to that. In terms of the provision of services, apart from the general outpatient clinics, we also have daycare services, including training for persons in mental recovery. We also have community services. For example, we have psychiatric nurses in the community to provide support for persons on mental recovery. We also run a hotline providing support to the same group as well. For ICCMW, Integrated Community Center for Mental Well-being, as I mentioned, they are our close partners. The hospital authority attaches great importance to our collaboration. So I just explained our support on 4 fronts. Well, we covered a lot of grounds. I believe that we will continue to follow up on these issues in our subsequent meetings. Dr. Tick would like to speak in the second round. I'll give him 2 minutes, and then I'll see if there is a response from the administration. Simply put, we want to do some real work. Today, some 50 deputations have attended our meeting to express their views. They cover a really wide scope. For frontline social workers, they've also talked about some specific issues. We understand the complexity involved, such as resources, premises, etc. I think we need to take a more active stance. Don't just invite deputations to come and tell us their problems and the administration to explain their stance, and that's it. It's not just about giving an opportunity for the government departments to tell us what they've been doing. We need more. We want to know your attitude and what you're going to do about the problems. I understand that there will be subsequent meetings. I'm going to offer my view to the governments on these various issues. Don't just tell me how many centers you have and what you and the manpower you're going to provide to support the initiatives, because this is public knowledge. I want to know your attitude and how you're going to make improvement. Because if the existing initiatives are effective, we won't be seeing 50 plus deputations telling us their problems today. So even if you're saying no to these suggestions, you should explain to us why. I hope that this is the attitude of the subcommittee. Thank you. Right, let me also respond to that. Like Dr. Teik Chi-yun said, we want to build a platform for the needs of the disabled to be heard. There are gaps in service provision of the government, and that's the function of this subcommittee. I'm grateful because today 48 deputations attended our meeting to express their views. The Secretariat also received 23 written submissions from those attending the meeting, as well as one submission from a deputation not attending today's meeting. So if you have other submissions to make, do write to us about the support for PWDs. I think that's all for today. The next item is date of the next meeting, and that's in November. We're going to discuss employment training and support for persons with disabilities, as well as the employment of disabled persons by the government. The Secretariat will be issuing a notice in due course. Right, if there is nothing else under AOB, then that's the end of today's meeting. Thank you.